Welcome back. The mother of a disabled man in Seymour has been fighting for a year to keep her son's health benefits. If you've ever tried to correct mistakes made by the government, you know how difficult it is to navigate all the paperwork required to get things right. Well, that's what Donna Peoples has been facing. So she called WATE 6 on Your Side consumer reporter Don Dare and showed him what she's up against.
Well, Lori, she's been told several times that her son's benefits are ending. Donna Peoples told us that her disabled son's health insurance company contacted her last year. She was informed that some of his federal benefits had been canceled. She won the appeal, only to be told at the end of last year that his entitlements were ending again. Well, she says the same pattern was repeated this year. For a year, Donna Peoples has been trying to resolve the confusing status of her son's insurance coverage. Her son, John Darr, is deaf and can't speak. He lost his hearing as a child from spinal meningitis. John, who was 32, graduated from the Tennessee School for the Deaf. Until a few weeks ago, he worked full-time at a home improvement store. Now, however, he's in the hospital fighting COVID-19. For years, John qualified for Medicare, Medicaid due to his disability. His hospital insurance is with Humana. Because of his disability and low income, he's also eligible for QMB benefits. That's the Qualified Medicare Beneficiary Program administered through TennCare. But Donna says there are ongoing discrepancies, and it's been a battle for her as she handles John's insurance affairs.
It started out August 2020. He lost his entitlement. I got it back. He lost it again. I got it back. He's lost a total of like 6 or 7 times.
In May of this year, she received a letter stating John's entitlement issues have been resolved.
I had do an appeal with TennCare, and before it even went to court, TennCare said, you're right, we're wrong. We made a mistake. So I thought I had that straightened out. Well, then I get another letter from Humana.
That letter, sent in June of this year, states his coverage will end soon, contradicting the previous letter sent a month earlier.
And they're saying that he lost entitlement again. I'm like, oh my gosh.
At that point, she called Medicare Medicaid Services and asked what's going on. She was told John's bills had not been paid.
$1,387.50. Another bill for $2,007, and I've been dealing with this since August.
And you can't get it straight.
Can't get it straight.
And there he is in the hospital.
And he can't even fight this. I can barely fight this. I've got 3 rooms full of papers.
And she says the documents keep piling up, one contradicting the other.
I just want them to get together, work this out, because there has been a bad mistake. They have not communicated.
The most recent bill states $2,600 is owed.
Medicare does not have it documented that TennCare Connect, QMB, is paying for John's B premiums.
That's why you're getting these bills?
This is why I'm getting these bills. That's what it is. Medicare is telling me, well, he needs to pay or he's going to lose his entitlement.
After we contacted TennCare, representatives from the state met with Mrs. Peoples virtually. Donna says basically the state informed her that they would intervene and talk with Medicare, Medicaid services to bring an end to the confusion and help resolve the issues with John's benefits.
I have fought this long. I don't give up very easily. I'm sure other people would have said, okay, forget it. I can't. He needs this. He's deaf. He deserves it.
Now, TennCare tells 6 on Your Side the issue originates with Social Security and Mr. Darr's eligibility for Medicare. TennCare says the Medicare-related letters issued by Social Security caused a lot of confusion. Donna tells us a second virtual hearing with the state is scheduled for next week. We will continue to follow this story.